Assalamu alaikum wa rahmatullahi ta'ala wa barakatuh. Welcome again, viewers, to this week's Islam Channel Health Show. I'm your host, Dr. Abdullah Shehu, and today is one of those days we'll be talking about a very rare topic which I'm sure you have never heard of before, and probably the best time in the world is going to be discussed. So I'm privileged to be the host for this show, and it's called dental anxiety. The reason for this is I'm sure all of us as children, we have been very terrified or more or less very much distressed about going to the dentist because of the thought of having a drill under local anesthesia, or even more so under general anesthesia for one reason or another. And even adults, we have that. So alhamdulillah, now there is a new concept which is coming out, and my guest today is a consultant pediatric dentist and specializes in children's dental fear. Inshallah, she will talk about anxiety and phobia and other behavioral problems that are facing children, and her qualifications in dental experience rank her to be the first dentist worldwide to measure and treat dental anxiety. And I'm glad to say, actually, she's from Saudi Arabia, and more specifically from Mecca as well. So that's very good. Hopefully, this new concept will help reduce the need for general anesthesia in young children. And this is a measure that she's invented over the last few years or so in her PhD work, which will hopefully be published in the near future, and will be the gold standard scale to be accepted worldwide for this kind of treatment, inshallah. Her name is Dr. Abia Al-Namakni, and inshallah, we'll be thrilled to welcome Dr. Abia to the health show. And assalamu alaikum. Welcome, Dr. Abia.
Walaikum assalam wa rahmatullahi wa barakatuh.
Right. Now, if you can kindly just briefly tell us about yourself and your background in terms of dentistry and what interested you in talking about dental anxiety or specializing in that.
Yeah, alhamdulillah, rabbil alameen, wa salatu wassalam ala Sayyidina Muhammad wa ala alihi wa sahbihi wa sallam ajma'in. First of all, I would like to thank you to invite me for this very good program. My background in dentistry started from Saudi Arabia. I graduated from King Abdulaziz University in Jeddah, and then after that I have like interest to treat and see only children, especially if they are scared, using the normal non-pharmacological behavior management things. After that, I came to England, to University College London in London, where I did all my postgraduate qualifications and degrees, master and PhD and other qualifications. And I decided to specialize in this field because it's a rare specialty, and maybe it's a new specialty as well for the world.
It is new, but
yeah.
Also, if I may ask, do you have any background in psychology? Because this is something normally will interest people who have studied psychology.
Yes,
before,
I do. I have some qualifications and training as well in psychology. Plus, I'm a hypnotherapist as well.
Oh, that's triple qualifications, mashallah. So, what has brought your interest to study this rare thing? Well, not rare condition, because it's very common. Almost all of us have been through it. But what made you interested in trying to alleviate this problem?
Actually, the interest started, when I used to go during my master training to general anesthesia, the theater. And I saw how it's really horrific to see a child going through the operation room and general anesthesia for, like simple dental treatment, extraction, for examples, or, other dental treatment, which is routinely, normally it could be treated on the chair. I'm not talking about the major surgical management. I'm just talking about the common dental treatments.
Yes.
So I said this is too much for the children, so I decided to go through literature review and systematic reviews as well, to see about the general anesthesia, effect of the risk of general anesthesia, the use of unnecessary drug with children because they are anxious. And I said, I decide now to be, to be focused on this field, the dental anxiety and behavior management, especially with children, because, according to the literature, it's very important to address the dental anxiety in a young age and to treat it better than to wait, because, anxiety is a common experience that everyone has from time to time.
Yes.
And severe anxiety can affect on the quality of life as well. And it has also other complications, medically, psychologically.
Absolutely. Well, how does that differentiate between hypnosis or hypnotherapy to what we're going to talk about in terms of your new measures of assessing anxiety?
Yeah, actually, hypnosis. It's you are when I use hypnosis, I'm talking to the mind of the person. Like, you know, when you hypnotize the person, then you will have like a chance to know more about what make the child scared, and what make him also, you know, relief from his worry or anxiety or things like that. The difference is hypnosis. Uh, you need to have like a quiet place,
Which will
sort
not
of
be.
sort of like a really, you know, comfortable place and environment, light, things like that. But what I'm doing at the moment, because, you know, the dental clinic, it's noisy and
Absolutely.
light everywhere, and so it's different in terms of the use and the place, where and when and with who to use
And
it.
maybe the subject also will be very difficult to start hypnotizing a child under that
Yes,
situation.
and the
Isn't it?
requirements as
And the
well,
requirements, yes.
because
So,
every child is individual. So
absolutely,
yeah.
absolutely. So tell us about the measure you use. How did you come to the conclusion of what kind of scale to use in order to assess anxiety, and then proceed to looking at how to manage it?
First of all, there are three main methods to assess the children anxiety: the behavioral methods, the physiological methods, and the self-reported methods. The behavioral methods, it still tends to be like the result of it's more subjected, because it's somebody observe your behavior and put the score. So it tends to be more subjective, maybe not reliable as well. The physiological measures. Sometimes it increases the child anxiety when you use, you know, the pulse, the heart rate machines, or some things like that. Sometimes, you know, the uh, it could give, you know, not the accurate results, because some people, you know, as soon as they walk into the surgery, the blood pressure increase, the heart rate increase,
Absolutely.
you know, all of these things like that. So the best method is to assess the anxiety is the self-reported measures, which is, you know, the patient, you ask the patient to report, to do the measure by himself.
Okay.
So it's more reliable, especially if it's used appropriately. I did systematic review to review all the dental anxiety measures worldwide, and the result, we found 30 measures just for assessing dental anxiety.
In children or
No,
both adults
30
and children?
measures, 30 scales in general.
Okay.
14 of them just for children. So these 14 scales, now 7 of them invented in the UK,
Okay.
5 in the USA, and 2 in Sweden. But the problem is none of them reach the criteria to be qualified to be as a gold standard measures. All of them, they are open to criticisms, and none of them address the cognitive status of the child and the relationship between the cognitive status to the dental anxiety. So that's why the idea of my new scale, which is ACDAS,
Yeah.
stands from ABIR, Children Dental Anxiety Scales.
That's very good. You've already got
yeah.
a name attached to it. MashaAllah.
Okay.
So is this age dependent as well or not?
Yes, of course. My scale used for children aged 6 years and over, because, you know, if you children under the preschool children, the very young children, their answer will be, you know, unreliable. And according to the literature, we found that there is no relationship between the score, which is, you know, by the preschool children, and their actual behavior on the chair.
Right.
Yeah, and also their cognitive ability will not be able to recognize and to understand the questions and to answer in appropriate way.
Okay.
That's
Okay.
why 6 years and over.
MashaAllah, good. I think now it's time sort of to talk about, or rather to show a clip of Dr. Abia in action. That's what we'll do, inshallah. And here we have a dental trauma, which we know can cause a huge amount of stress for children. And one of the patients Dr. Abia has been treating is a very young girl. She's only 9 years old, and her name is Holly Mason. The health show here went along to visit Holly and her family at home to find out about her story. So we will show now as a clip, and shortly after we come back, inshallah, there will be some opportunity for you to ask us questions, inshallah. Assalamu alaikum. See you soon.
This is 9-year-old Holly Mason. She lives with her younger brother and sister, mother Sarah, and father Paul. Last year, Holly suffered a traumatic experience when she fell off her bike and sustained injuries to her face and teeth. It was an experience that has affected the whole family.
It was after school and I was indoors. It was September, so it was nice out. So Holly and Fred were out front playing with their friends, and they had one of the bikes out from next door. And the next thing I remember was Fred come running in saying to me, "Mummy, Holly's got a nosebleed." And I was just like, "Oh, another nosebleed," because she suffers from them. Walked outside and was met with complete devastation.
I was helping someone out at a friend's house and got a frantic phone call from Holly's mum. Obviously, she said she's had an accident. You know, you automatically think the worst, but I wasn't nowhere near prepared as to when I first see her. You know, it's quite scary to see your child in that situation.
Paul Pritchard is Holly's grandfather. He has been with Holly every step of the way since the accident, attending all of the hospital and dentist appointments with her.
There's blood everywhere. Holly was being picked up off the floor by her dad, and she looked in a terrible state facially. It looked awful.
Well, all my lip was swollen. This one here, half of it was gone, there was only a little bit. That one, it was chipped.
Paediatric dentist Dr. Abir Al-Namankani treated Holly after the accident. She helped Holly get through the anxiety and restored her teeth.
I saw Holly about almost a year ago when she was 8, now she's 9. She came to our hospital referred by her general dentist. Like she had the trauma, the accident. They admitted her in the A&E department. And then they did all the checkup, the CT scan and everything. And she got some bruises and trauma in her leg and hands as well, plus severe dental trauma, fracture in her teeth.
First thing the doctor said to us was, "Are they a baby teeth?" And we said, "No, they're an adult teeth." And I just thought that was it, she'd lost them for good and she was just going for no teeth.
The front tooth was completely split at a jag across the front, and the tooth beside that was ripped off up by the gum. I was absolutely gutted what happened to her. She's such a beautiful little girl, she's my little princess, and to see her in that state, it just brought tears to my eyes.
She had a lot of trauma to her face. Her lip was really swollen, her nose was sort of out of shape. Obviously, she'd lost a couple of teeth at the front, and you know the blood was unbelievable, and she was obviously quite distressed herself.
She doesn't have any previous dental experience apart from regular checkup. That was extremely traumatized for her. When she saw her teeth fractured, bleeding, blood everywhere, she was very worried about what's going to happen to her.
Oh, I was scared because I've never had anything done like it before.
Sometimes she jumped from the chair, she threw the rubber dam, everything she threw it, she started screaming, shouting.
Dr. Abir was just fantastic in settling her down, getting her in a frame of mind that she could accept the treatment. And once Holly understood what was expected of her as a patient, she seemed to settle down into the treatment, and it was better every time we went.
She had the most difficult treatment in dentistry, which is the root canal treatment, especially in the front upper teeth. Very sensitive area to have the injection and the root canal treatment. So she's progressing very well.
When they said, "Oh, we're going to build it up, put a cap on it and we'll get it matching," I you just don't think that they can do that. And then when she come home one day with it done, I was so amazed, because you look at the photograph of her that day and before the accident, and it doesn't look like there's been any damage. She just looks like the same teeth.
From the way she was the first couple of times she visited Dr. Abir to how she is now, the anxiety, you know, panicking, sort of lashing out a bit. I mean, it's changed. I mean, she's changed in herself tenfold since the accident, I suppose.
Since I've had the accident, my teeth have improved so much.
Thank you for giving me back my little princess. You know, she was beautiful before the accident, and now she is as she was. And I just don't want her to have anything like that ever again. When
she first met Dr. Abir, shy and taken back, but because she's got the confidence of talking to Holly, and Holly's built that confidence with her, I've noticed it with other people as well now, that she has more confidence with strangers. She's got a lovely smile, and I really didn't want her to lose that smile.
I couldn't thank her enough, you know. She gave me my little girl's smile back.
Assalamu alaikum warahmatullahi ta'ala wa barakatuh. Welcome back again, viewers, to this week's edition of Health Show. As you know, we've been talking about dental anxiety, and I've been interviewing Dr. Abir on her pioneering work in terms of treating dental anxiety. Now, while we're seeing the clip, which is obviously very emotional, I'm pleased to announce that the two of our guests who've been interviewed there are here with us. Holly Mason. Hello, you're welcome to the Health Show. And Mr. Paul Pritchard, who is the granddad of Holly, inshallah. So we'll be talking to them now to find out more of their experiences of what has happened with Dr. Abir's treatment. So, Mr. Pritchard, how do you feel sort of when you're going through the process of what Dr. Abir was proposing to do?
At the very beginning, we just wanted the best for Holly, and as the treatment progressed, we could see the difference and the signs, and everything was looking good, and to the end result of today, where she's perfect and back to normal.
Right. And obviously it was very distraught sort of to see her at that stage when we saw in the video there. It was a very, very painful experience and all that.
The family and friends were all distraught to have seen what had happened, and very emotional time for all of us, and a very difficult time, but once she got into the treatment,
it was all fine.
It was okay, yes.
Holly, anything you want to say about what your experiences were? How was it when you had the injury? Very, very painful?
Yeah.
Yes. And what happened after that when you had the treatment with Dr. Abir? Difficult? Are you very anxious now to see a dentist? Not anymore.
Not anymore.
Yes, so you've been cured.
Yeah.
Yes, probably one of the first in the world now, isn't it? Yes?
Yep.
Okay. So, Dr. Abir, how was the treatment unique in terms of what would otherwise have happened if this procedure you've invented was not available?
Yeah. Of course, you know, like what's happening every day and everywhere, they tend to refer the anxious patient to have the treatment under general anesthesia or the unnecessary use of drug, including the sedation drug, the happy gas, because even at the end, you know, the nitrous oxide is a drug, and every drug will have side effect, of course, you know. So the good things for Holly that she completed all the treatment without using any drug. Apart, of course, from the, you know, the dental things, and but I'm talking about the dental anxiety point of view.
Yes.
Yeah, so it's good, and also, you know, I would like also to address that the cooperation of the parents is very, very important, and I really appreciate Holly's parents and grandparents as well, and you know, that they help me to treat Holly, and also Holly she's now very
brave.
confident, very brave girl, you know, to stand all of this procedure.
Yes. Mr. Pritchard, obviously this was your first experience of a program like this. How was your anxiety level before sort of the introduction of this problem by Dr. Abia? Did you start believing, saying it may work or it may not work? What did you feel?
Well, obviously, we were completely new to it. Even myself, I've only ever had normal dental treatment, and this was a severe trauma of Holly's mouth. We needed Holly to calm down a great deal. The first time she was very traumatised because of the injury within 24-hour period. But Dr. Abir explained it all to us, what she was going to do, what she wanted to do, and we were quite happy with that. We wanted to go along with that type of treatment as opposed to surgery in a theatre with general anaesthesia. So we were very, very happy to give it a go, and I'm very pleased we did. Because
and I'm sure her parents bought the idea
oh
quickly
yes,
as well.
that's right.
Yes,
yes.
Their anxiety level needed treatment. I don't know.
well, my daughter, she was pregnant at the time.
Oh my God, yes.
And she was not many weeks off from the baby, and it was in the back of our mind all the time that this may trigger something where she would prematurely have the baby, but that was in our minds all the time as well. And you know, we done what we done with Holly and Dr. Abir, and we're glad we did.
Good. Alhamdulillah. Now, viewers, inshallah, the telephone line is there for you to ring and ask us questions. And certainly, I'm sure you may have one or two questions for Dr. Abia and this new pioneering work she's done. And so we wait to hear from you while we carry on with the rest of the program, inshallah. So, Holly, would you recommend this to your friends? The treatment? Would you recommend the kind of treatment to your friends? Sure?
Yeah.
Yes? To adults as well, or only children?
Adults as well.
Adults as well. Right. Okay, that's very good. I think that the whole program sort of speaks for itself, isn't it? Right. Okay. So what will be the way forward in terms of how do you, this is a normal practice now you do for all your patients, or is it only to selected few?
No, only the extremely anxious children.
Okay.
Extremely difficult parents as well.
And those that are not anxious, what sort of treatment do you offer them? What sort of procedures of sedation or anesthesia do you offer them?
We offer them the normal dental treatment, all what they need, because actually Eastman Dental Hospital is a very strong specialized center worldwide.
Right.
And we have referral from all over the places, you know, from everywhere. So we have everything. We have all sorts of treatment, sedation, non-pharmacological and pharmacological, everything.
Yeah. So how long does it take you to actually do the assessment, finish in time for the treatment? How much time does it require for that to happen in terms of the preparation?
Throughout the treatment with Holly, I used my scale, the AC does, and actually it just take about 3 minutes to complete the scale, the measures.
Right.
So after 3 minutes, I assess her anxiety every time I see her, and this will help me also, and will help her when she see her results, like in the first visit, in the second visit. This is very good. This is very good way to control, to control the patients and to control yourself as well, and to monitor yourself. So first visit, her score was 40. That means she was extremely anxious, and the last visit she was just 19. So that shows the big difference in her anxiety level. And the cutoff point for my scale is 26. So any patient score 26 or above, then that means he is scared.
Okay, and that means what? Do you offer your treatment? Or
that means he's scared, so we need to have a treatment plan for his anxiety, separate than the treatment plan for his dental problems.
Okay. So this is a procedure that you can only do for elective procedure, is it? If somebody comes to see you urgently and they need a dental treatment there and then, can you do the same treatment to avoid anesthesia if you have to remove a tooth for an infected tooth?
Actually, I have many patients, they request to have appointment with me, but because at the moment I'm doing the research in Eastman. I'm not employee by Eastman. So I hope if I become employee by Eastman or by any other NHS premises, hospitals, things like that, then I will have the the focus and the time to have a special clinic just to treat the dental phobia cases for children, and I believe it will be the first clinic worldwide, because at the moment there is no any clinic specialized for children dental anxiety by dentists. Some clinic maybe you can find other clinic by psychologists only, but not at the end psychologists are not dentists, so they will not be able to do the dental treatment after they treat the anxiety. But for myself, I treat the dental anxiety first psychologically, and then I start the dental treatment as well. So I do both.
Okay. Now, while we're still here, sort of, can you show? I know this is not the actual teeth of Holly, right? Can you show us which teeth you had to treat in Holly's case? And
yeah, Holly, actually this is supposed to be like this other way around. So she had trauma in her front teeth, the 4 of them, the 2 central and the 2 laterals.
Right.
She has a complicated crown fracture for her upper left tooth, which is the second one on the left. Yeah. It was almost like flush with the gum level, with the gingival level, so it was no tooth, any tooth tissue left. Right. And the first one, it was a crown dentine fracture, so both of them were exposed, very sensitive, and then she has subluxation injuries for the rest. Yeah. Plus, you know, the huge swelling in her lips, upper and lower one, as you saw in the pictures, and bleeding. It was very difficult for her to open her mouth.
And how long was it between the time you first saw her to the time of the treatment? What was the interval?
I saw her the following week, straight away. You know, I canceled. I was doing other stuff for my research, but I canceled what I'm doing, and I just booked her like emergency appointment with me, and then I was seeing her regularly until she completed the treatment.
Right. Okay. Good, good, mashallah. So, Holly, any advice to your colleagues and mates? This is a good procedure. You happy with that? Yes. Good, good. Mr. Pritchard, anything to say?
Well, I do hope the procedure's rolled out, definitely, because it helped Holly a great deal. I mean, we could see the anxiety levels dropping week on week on week. And it's not because the treatment was getting any easier. Yes. It was because she was being made to understand what was happening to her and what she had to do as her part of the treatment, as well as, you know, other people sort of working on her. So, yes, it's brilliant, absolutely brilliant.
Yeah. Well, certainly I can't thank you enough, and I'm sure the public will not thank you enough as well for joining us in this health show. So I'd like to seize the opportunity to say thank you to Holly and thank you to Mr. Pritchard for joining us. I will be going in a break soon, and we'll come back and ask more questions from Dr. Abia. But thank you both for coming to join us, inshallah. So, but before we close, one final just question, maybe for 10 seconds. Okay, anyway, I've been warned that we haven't got much time for me to ask you another question, but suffice to say that Holly has been very, very brave, and more brave even to appear on TV to actually express her case with us. So sharing this is the greatest contribution. You can't imagine how much you've done to the rest of the public and to children like you, and it's a pioneering work which you'll be a party of now worldwide. So you've been watched all over, and thank you very much. So inshallah, we hope to see you soon. Assalamu alaikum wa rahmatullahi ta'ala wa barakatuh.